I'm going to be demonstrating a trach suctioning today. I've already verified my order and I've gathered my equipment. Since we're not in a perfect world and we don't have an abundance of supplies, I'm using one that's already been opened, but we're just going to pretend like it's not open and it's sterile. So we're going to go ahead and go to the room now. Hello, my name is Liz. I'm the nurse today. I've got some orders to do some trach suctioning as needed. I'm going to provide for privacy. I've already washed my hands. I'm going to verbally state her name, date of birth, and the allergy that we have on file. Since she has a trach, she's probably not going to be able to respond as far as telling me everything. So your name is April Lancaster, correct? And your date of birth is 12/28/54, and your only allergy is Dilaudid. Okay, she has acknowledged that that is correct. It matches her ID bracelet. I've compared it to the MAR and the orders, so we're good to go. First thing that I'm going to do to assess whether or not she needs the suctioning is I'm just going to visually look around the trach and see if there's any secretions, drainage, anything like that, and I'm going to note the color, the consistency, and the amount, and it does appear that she has some. Second thing that I'm going to do is I'm going to listen to her lungs. And I'm going to listen in all 5 fields. Okay, I've listened to them and it does sound like she does need some suctioning. So the first thing now that I'm going to do to prepare her for the suctioning is I'm going to put her in the Fowler's to high Fowler's position. I'm going to turn the oxygen up to 100%. I'm going to turn the vac suctioning between 80 and 120. I'm going to go ahead and attach the pulse ox to her finger so that I can keep track of her O2 sats during the suctioning. I'm going to let her hyperoxygenate anywhere between 30 seconds to 3 minutes. While she is hyperoxygenating, I'm going to go ahead and get my area ready. Wash my hands again and go ahead and open the sterile packaging. This is the little box and container that we're going to use to pour the solution in. So I'm going to take it out and just be very careful not to touch around the top or the inside because that needs to remain sterile. The solution that I'm using, I've checked the date. It's not expired, the color is good, and the clarity is good. So we're going to go ahead and pour that in there. I'll go ahead and wash my hands one more time before I put my sterile gloves on, just to be sure. Ahead and remove the catheter from the packaging, and we're good to throw that away. Now I'm going to go ahead and hold this with my dominant hand, which is my right hand. I'm going to hold the connector with that, and then I'm going to coil the tubing into my hand just to be sure it doesn't touch anything while I'm trying to connect it and contaminate it. This is my dirty hand, so I'm going to attach the suction tubing to the catheter. Be sure not to touch that other end with my clean hand. Okay, so now that I've got it attached, I'm just going to uncoil it and make sure that it doesn't touch anything else. Now I'm going to go ahead and insert this into the solution just to make sure that it is suctioning properly. And it is. So we should be ready to suction. I'm going to remove the oxygen tent from her trach. and go ahead and insert the catheter, being very careful not to touch the outside or around the trach itself. I'm going to insert very slowly until the patient coughs or I hit resistance. I've hit resistance, so now I'm going to begin suctioning intermittently. While removing, I'm going to be twisting it and continue to suction intermittently. Okay, I'm going to go ahead and reapply her oxygen so she can hyperoxygenate again. We're going to let her sit for at least a minute in between each suction. While she is hyperoxygenating, I'm going to go ahead and rinse my catheter out and coil it back in my hand just to be sure that it's not contaminated by anything accidentally touched. At this point, I would reassess her lung sounds in all 5 fields. It does sound like she needs some more suctioning, so we're going to go ahead and administer one more round of suctioning. I'm going to remove her oxygen tent and uncoil very carefully and go ahead and insert. Be sure not to touch anything else. And I've hit resistance, so I'm going to start intermittently suctioning, and while I'm removing, I'm going to be twisting it. Okay, I'm going to reattach her oxygen tent over her trach, and I'm going to go ahead and rinse the catheter out again. Coil it back in my gloves just to make sure it stays clean. Let her sit for another minute or so to hyperoxygenate again. I'm going to listen to her lung sounds in all 5 areas. At this point, it does sound like they are clear, so we don't need to do another round of suctioning. So I'm going to go ahead and detach the catheter. And I'm going to remove my gloves holding the catheter tubing in the glove. Dispose of it. I'm gonna go ahead and wash my hands again. Now I would put some clean gloves on. I would clean up around the trach area, clean up any other trash that I have, put the bed in the lowest position, give her the call light, make sure that she didn't need anything at that time. I would turn the oxygen levels back down to what the original doctor prescribed percentages were. I would turn the suction back down to intermittent. I would remove the pulse ox, just make sure that her O2 stat is good, and wash my hands. For documentation, I would document the amount of drainage that I removed from the trach area. In this case, it was a moderate amount, it was thick, and it was clear. I would document how many rounds of suctioning it took to get her lung fields clear, and I would also document how she tolerated it. She's tolerated it well. I would also document what her O2 stat was during the procedure, during the suctioning, and then right before I left. And that's it.